Hi, I'm Michelle Adubato. The North Ward Center is committed to educating the public about the importance of community programs that give all New Jersey residents a chance for a better life. That's why we're proud to support the important educational programming produced by the Caucus Educational Corporation.
State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by the New Jersey Education Association, the Turl Fund, supporting Right from the Start NJ, the North Ward Center, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, Summit Medical Group, Delta Dental of New Jersey. Everyone deserves a healthy smile. And by Keystone Mountain Lakes Regional Council of Carpenters. Your future is in our building. Promotional support provided by the New Jersey Business and Industry Association and by Insider NJ.
Welcome to State of Affairs. I'm Steve Adubato. We are, in fact, coming to you from the Agnes Veris NJTV studio of Newark, New Jersey. It's my honor and pleasure to once again welcome State Senator Joseph Vitale, who is the chair of the Senate Health, Human Services, and Senior Citizens Committee, vice chair of the Senate Labor Committee. Good to see you, Senator.
Good to be here. Thank you.
Thank you. Let's jump right into a variety of issues. The first one, Catholic Church, no secret, crisis going on for decades now involving priests who have, in fact, assaulted, abused, disproportionate young boys. Pennsylvania grand jury investigation produced what? And then we'll talk about New Jersey.
Well, the Pennsylvania grand jury produced 900 pages of report, 1,000 victims and counting, 300 priests were named in that abuse over decades. And that's just really the tip of the iceberg for the rest of the country. In New Jersey, we have the same problem. You know, sadly, our Catholic Church in New Jersey recently stated that New Jersey is no Pennsylvania. I don't even know what that means. The abuse.
That was the official statement of
that
the
was
church?
One of the official statements, yes, initially. You can look at us, but we're no Pennsylvania. That's just wrong. We know that. I've worked with victims and survivors for 20 years in the legislature since I've been in office, and I have met with dozens of them. And the stories are just awful. How the church hasn't responded appropriately. Now, the Attorney General has launched an investigation. I've asked them to do that. They're going to impanel a grand jury eventually.
Attorney General
Graywall here in New Jersey.
Right.
Going to impanel a grand jury eventually after the task force does their work. They're going to subpoena all the records and find out where the truth is.
What's the goal?
Pardon me?
What's the goal?
The goal is to establish that there has been over decades, not just a pattern, but institutional abuse and a cover-up by certain bishops over time. And that abuse has not stopped. We still hear about cases today. I think the church has done a better job trying to weed out bad actors. But when you rape a child, there is no excuse. There's no justification for that, of course. And now, many years later, when they're adults, they have no remedy other than to sue their abuser, their rapist, and the institution that may have enabled that abuse in court. And that's what we're fighting for.
We're talking with State Senator Joseph Vitale. This is a national issue, not just a New Jersey or New York issue. Statute of limitations as it relates to these cases, your legislation says what about that?
Well, I've worked with the survivors, and they said we need a compromise. 2 years is too short.
So right now it's 2 years after the incident, or?
It's 2 years after the discovery. So if we turn 18, you have 2 years to bring a claim, meaning that the statute of limitations says that the discovery rule is this. Once you connect that your injury, your psychological, emotional damage has been done to you, with the abuse, you have only 2 years to bring a claim against your abuser or the institution.
What's wrong with that, Senator?
Well, it's too short because you have victims and survivors have not ever reconciled this abuse. They live with it every day. They're not told their wife, their husband, their mother, their father, their sister, their brother, their kids that this happened, and now you expect them to tell their family what happened to them and relive that abuse again. It's like asking a rapist to relive the rape and all those awful memories that they've carried with them all these years. And so 2 years is too short. The survivors would like 7 or 8 years or age 55. It's not complicated, but The legislature has been much more accepting of making change now.
The mood is right to do this?
It's always been right, but now...
It's always been right, but it hasn't been done.
There have been
other attorneys general who have not done it. There have been other government officials at the highest levels in the state of New Jersey who have either refused or couldn't or whatever you want to say. No, this is not a secret. They have known it, and they have chosen not to pursue this from a legal, governmental, public policy, legislation, none of it.
I've asked them for...
And is that an overstatement?
No, it's not an overstatement. I've asked them for... I've been in office for 20 years, and I've met with every attorney general. And they've all said, well, we have this memorandum of understanding with the church, and
what?
They're doing a better job of cleaning up their act. And
how about naming the people? How about naming the people who raped little boys? No,
girls.
That wasn't part of the agreement, was it?
No, only going forward. Only after that agreement.
You mean if something happened after that?
Before
what about
that. If something happened before that, we don't need to hear about it. We need to know about it. It's after the fact. After 2002, they enter into an agreement with the church, and they say that you shall tell every story going forward, but not retrospectively.
Steve Adubato, this is State of Affairs, talking with Senator Joseph Vitale, the issue of sexual abuse, the assault of young boys by priests in the Catholic Church, and the way the church has dealt with it. Wondering, where is the church on this? Our executive producer, Jackie Heyer, our entire team, we reached out to the church more officially, more specifically, my diocese, Archdiocese of Newark. We are waiting for Cardinal Tobin to agree to, I don't know, Jackie, tell me how many times we've asked. We're waiting, look forward to that interview. It's been many, many times, and I promise you he will be here, hopefully, and respond to those questions. Is that part of the story? That they're not very public about how they talk about this?
No, they don't. There was a prayer service just last week at the Basilica, and they asked for prayers for the survivors, and they talk about how sorry they are that this happened. And I know they're being very genuine about that. Yeah. But that doesn't mean that they've really exposed what happened.
And the Pope?
Well, I'm disappointed in the Pope that he hasn't gone far enough. He has to say that all the bishops that knew, any archbishop, any church leader who knew about this abuse has to go.
One more thing on this. We'll have the Attorney General in the state of New Jersey, Attorney General Grewal, who will be joining us. There is, in fact, Jackie, if we can find that hotline and put it up, there is Attorney General's office. They have a hotline where people 24/7 can call. If they have been abused, they have a case they want to report, dealing with what we're talking about right now. That's how important it is. Let's shift gears.
And it's ringing off the hook, by the way.
I know. Apparently, they can't even handle the number of calls. Excuse me, Senator. I talked offline with you about an initiative we have called Right from the Start, NJ. Our team will put up the website right now. Looking to protect, take care of, deal with the needs of infants and toddlers, 0 to 3. We had State Senator Teresa Ruiz here, your colleague, talking about legislation you're involved in. Had the Commissioner of Health, Commissioner of Family Services, I'm not sure the exact title of the department, but a whole range of other government officials dealing with this population. What is the primary focus and concern you have as it relates to dealing with those who are 0 to 3 and prenatal care connected to that as well for moms who give birth?
Sure. Well, we know that there are a number of issues involved in that this particular topic. All parents know, and most experts will tell you, that a child's development between the ages of 0 and 3 is paramount to their development over time. If we don't get them earlier, sooner, then they fall behind. They fall behind those children who have access to take care of child care and good teachers. So we're hoping that over time, particularly children and families who don't have the means and the wherewithal to afford child care. We just had a child 9 months ago. It's expensive. To expect a middle class or a low-income family. Yeah, the low-income family. Thank you. Low-income family.
You told me you're not
I'm sleeping a little bit. A little better. Mom's taking the beating, not me.
Got it.
But if we don't catch them early enough, then it's tragic for them because they fall behind.
What about child care workers? Senator Ruiz talked about this. What are we paying child care workers? Is it enough? How does this impact who we're recruiting and retaining into this critically important field, protecting infants and toddlers?
Well, it's just like we talk about home care workers, people who come into the homes or folks who work in nursing homes, people who have the toughest jobs, people who are taking care of children. Many times it's 3 or 4 at a time, right? That's the limit, that's the ratio. It's difficult work and it's important work. And if we don't pay them a living wage with benefits, how are we going to recruit and retain people? Anyone who's watching this knows that you have a job, even if it's, you wake up sometimes you're not happy about going to work, but you're making a good living, you're providing for your family. If you can't do that as a child care worker, you're going to go someplace else.
Educating the public about prenatal care. And again, we'll put up our website again. Why is that so important?
Well, prenatal care is important for the mom and for the kid. So we, St. Barnabas, Robert Wood Barnabas and the Barnabas Health System have done a great job at a new initiative to really ramp up what's called Stop, Look, and Listen, to talk to the mom just after they've given birth and before to make sure that she's okay. And there are signs that they need to sort of acknowledge if she's in trouble or maybe in trouble going forward. But prenatal care is paramount in New Jersey, especially in urban communities where healthcare access is limited through Medicaid providers. Those moms don't get the prenatal care they need, and the kids suffer for it.
We're talking to State Senator Joseph Vitale, the leader of in the state legislature when it comes to a whole range of healthcare issues. Steve Adubato here. This is State of Affairs. The Trump administration and their efforts as it relates to, I'm not going to say dismantling, but changing the Affordable Care Act, otherwise known as Obamacare. What does that mean in New Jersey, A and B? What are you and your colleagues doing to protect New Jerseyans and their health coverage?
Well, Donald Trump and the Republicans in Washington, as you said, made it a mission when
Congress.
Congress, right, to dismantle the ACA. And they've been doing a pretty good job of it lately, but New Jersey has stopped them. So Governor Murphy signed my legislation just a couple of months ago that requires individuals in New Jersey to have health insurance. The Republicans in Congress and the president are doing away with that at the end of the year, and that's very important to know that.
Is that the individual mandate?
The individual mandate. So you have to have insurance. And we also passed the bill the governor signed that will lower insurance rates in the individual market by nearly 9% next year. It's a new reinsurance model. It's adopted by states across the country, Republican and Democrat governors. Scott Walker in Washington, in Wisconsin, Republican, Democrats in New Jersey and in Oregon and other places have adopted this new measure. Lower insurance rates, that's never happened in the history of health insurance. So that'll go down next year for those individuals. And so we've done what we can to push back against Washington, push back against what Trump and the Republicans in Congress have said is just an awful healthcare system. And they've never suggested replacing it with anything better.
By the way, what happens if the Affordable Care Act, the ACA, Obamacare were done away with, repealed totally? What do you think would happen?
Well, it would be a disaster for millions of Americans and for hundreds of thousands, if not millions of New Jerseyans, because they will be left without insurance. And those who are left with insurance, whether through business or otherwise, will pay more because people who are sick will go to the hospital. Those rates will skyrocket, and those costs are pushed onto health insurance plans that the rest of you and I have.
But Senator, before I let you go, there are some aspects of the Affordable Care Act that you and many others have acknowledged, hey, wait, it's not right. It's not working the way it should.
Well, look, I think that if the subsidies that we provide for low-income families was greater, because you have a bubble, right? If you earn up to a certain amount of money, you get a subsidy. Just over that, you don't. I'd love to see the federal government be able to say, look, we're going to raise that cap, but they won't do that because they want it to fail. If we did it in New Jersey...
They want it to fail?
Of course they do. They've said that they want it to fail. They want to dismantle Obamacare, the Affordable Care Act.
By it failing and then saying, you see, we were right?
Well, making sense of what they're saying has never made sense.
This is State Senator Joseph Vitale. Joe, I want to thank you for your service in the state, the role you're playing in the Senate Health, Human Services, and Senior Citizens Committee, and also the Vice Chair of the Senate Labor Committee, and also, more importantly, being a dad, new dad.
It's great
How many
stuff.
months again?
9.5. Best thing I ever did.
Thank you, Joe.
Thank you,
Appreciate it.
Steve.
Stay right
My
there.
pleasure.
State of Affairs, Steve Adubato. We'll be right back.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We're pleased to welcome two very good friends of the show, Brendan Gill, Democratic strategist, Essex County freeholder, and principal in the BGill group, and also Mike DuHaime, Republican strategist, partner at Mercury. Good to see you, gentlemen.
Thanks, Steve.
Want to talk a little politics?
Sure.
Okay, we're in the fall of 2018. Are people engaged in this so-called midterm election with the U.S. Senate race, Bob Menendez, Bob Eugen, and a bunch of congressional races? Are people saying, hey, I'm in?
I got to tell you, Steve, from the Democratic side of the aisle, I've never seen this much engagement in a midterm election year. I've been involved in campaigns up and down this state over the last 20 years. Happened to also participate, in local party activity. I have never had more people raising their hand to volunteer, to canvass, to phone bank, to plug in So there is a lot of engagement.
See energy. What do you see,
There's
Mike?
a lot of energy out there.
Yeah, I think one way you engage intensity and energy is through the number of votes, the sheer number of votes that are cast. And looking at primaries is a bit of a harbinger. And if you look at what happened in New York, the turnout in New York just a few days ago, last week.
The Cuomo primary?
Cuomo primary was double what it was 4 years ago. If you look at the New Jersey primary this year, Democrats had a very high turnout. And it's something that people overlooked in the 2016 presidential election. There was far more intensity on the Republican side in the primaries. There was so much focus on Donald Trump, but Hillary Clinton was getting far fewer votes than Barack Obama when he won the primary. So there is intensity on this side, on the Democrat side. I think you have to, if you're a Republican, you have to see that and acknowledge it and obviously figure out a way to fight through it. But that intensity is there.
I would agree with Mike on that point too, Steve. And also one even statistic from the gubernatorial election last year in the state, in the Democratic primary, there were more votes. Governor Murphy at that time, candidate Murphy at that time.
I think you did. You run that campaign?
I did run that
I'm
campaign.
joking. We know you ran the campaign. Go ahead.
That's okay. Well, you know, got to get it while you can.
Yeah,
exactly.
What were you gonna say?
I was going to say we received under some brilliant leadership. We received more. Ambassador Murphy at the time received more votes, just raw votes, than were cast in total in the Republican primary. You know, so you can, I agree with Mike, you can sometimes see the intensity on either side by looking at primary numbers. And I could tell you anecdotally, just being out there in the field quite a bit, there is some real intensity out there.
So, Mike, let me ask you, how much of this race, the U.S. Senate race between Menendez and Yuga, and how much of several congressional races, by the way, I think at 23 or 24 seats, the Democrats have to turn around the House.
They have to win 25, they'll have a majority.
You have to win 25 seats in the lower house for the Democrats to have control of the lower house, which could have all kinds of implications. Let's leave impeachment discussions off the table. How much of this U.S. Senate race in New Jersey and the congressional races are influenced by, let's just simply say, President Donald Trump?
They're very much impacted. Historically, the first midterm of president in power, their first time after 2 years, historically is bad for the party in power. George W. Bush being an exception, the year after September 11th being an exception where Republicans picked up seats. But if you look even at President Obama's numbers, Republicans picked up 63 seats in the House in 2010. 63. And his numbers, for as much as, you know, we look at Donald Trump and I think in this part of the country as, you know, very unpopular, his numbers are actually nationally not that different than President Obama's were at this time in his reel. So 63 seats are what happened in 2010. And if you look back, even Ronald Reagan, George H.W. Bush, Bill Clinton, obviously 1994 was a Republican revolution. There is this pushback. So it's a factor. People are looking at it as a factor right now and whether or not they want to check him. And that's why these individual races then will take some shape. But certainly the backdrop is one that is traditionally favorable or typically favorable historically to the party that's actually out of power. Right. And I think you're seeing that and Republicans are going to have to fight against that.
It's right there, Brendan. Steve Adubato here with Brendan Gill and Mike DuHaime. By the way, if you want to find out more about the congressional races, we have U.S. Senator Bob Menendez and his Republican challenger, Bob Hugin. It's a half-hour special with the two of them. You want to check out the congressional candidates? Check out my colleague, Michael Aaron, who does a better job than anyone interviewing those candidates on his program, On the Record. Check Michael out there. You were going to say?
I was going to say, Steve, too, that I think the other thing that you're seeing from 2016 to your original question about what is the Trump is it the Trump factor that's causing that engagement? And I would say absolutely. You know, what I've seen in a state, again, in New Jersey at least, that there were many people who, at least in the Democratic base, who voted but didn't do much more than vote. And I can't tell you how many people are out there saying that they need to do more. So they're participating actively in these congressional campaigns in a way that they haven't in the past. What's the result of that? You see Democratic congressional candidates competing in districts here in New Jersey that we have never competed in before. So there absolutely is a huge impact on the president. I don't want to say I agree with Mike though in terms of the challenge for a sitting president in the midterm elections.
You think this is different?
I agree, but I think there's something different going on out there right now. So I think it's a combination of factors. It's a combination of the president, his style, the day-to-day news that's coming out of Washington, and also this idea that people who were surprised by that result, again, I'm talking really more specifically to New Jersey, not nationally, but many people within New Jersey, I think, across the board, were surprised that he won, and they decided and have decided that they need to be more a part of this process.
And is this the time they show that?
And this is the time they show it.
Mike, how challenging is it? Forget about policy for a second. Even with one policy in New Jersey that matters, and we've spoken to several. Well, Steve Sweeney, the Senate President of the Senate, will be here. Other members of the legislature, members of Congress will talk about the impact of salt deductions, state and local tax deduction, a cap on $10,000 the federal government has put on New Jerseyans everyone across the nation on your state and local taxes. By the way, that matter?
It matters in New Jersey. I mean, disproportionately, there are 4 states that ended up really being hurt by that, New Jersey being one of the biggest
California,
ones.
New York?
And Maryland being the 4th,
Good.
along with New Jersey. So there was, yes, I think, but there is the counterbalance to that is that the economy is going very well. Now,
it really is.
Now, if the president could speak just about that and not about a myriad of other things, he hasn't shown the ability to do that at this point. But I think if you could focus just on that, Republicans would be very happy, and they would be able to say, we're putting conservatives on the Supreme Court, we are getting tax cuts, the economy is going in a good direction. So many of those other indicators, the many people who voted for the president should be happy with, but there are so many distractions out there that we're not talking about the economy. Normally, we would be talking about the economy be a good thing, and it would really be a pushback against that historical norm that I talked about, but it's not a focus.
That's Mike DuHaime. This is Brendan Gill. I'm Steve Adubato. Brendan, I'm going to ask you guys both this. Don, is it the Trump party, or is it still the quote-unquote Republican Party?
I think it's both at this point. I think Donald Trump is the leader of the party, whether everybody in the party likes it or not. He is the president of the United States, and with that, that defines the party to most people. It defines the party certainly to the opposition party and to independents.
Is it challenging for you,
And within
Mike?
the Republican Party, it is a challenge.
As a very middle-of-the-road Republican who's dealt with all kinds of people, was a key leader, an advisor to Governor Christie, worked across the aisle. Is Trump hard to have him be the leader of this party? It's
difficult because there are certain parts where the party, where I and others, I mean, you never agree with anybody 100% of the time, right? But there are certain parts, certainly in New Jersey, where we're as diverse as we are, and some of the issues that come up that have racial overtones, ethnic overtones,
or that
we're very
3,000
uncomfortable
people really
with
didn't die in Puerto Rico was a Democrat.
Yeah, those are very difficult. I think the hard part for a lot of Republicans is there are some policies we agree with, and the style and some of the rhetoric is something that we find intolerable.
Got it. Well, Brendan, how about the Democrats? I'm curious. You've got Democratic socialists, folks very far to the left, who are winning in certain primaries. You've got other mainstream, let's just say you got mainstream Democrats, and you have Steve Sweeney, the president of the Senate, coming here in just a little bit.
Right.
How fractured is the Democratic Party these days, and which party are you a part of?
So let me take
that big?
Yeah, it's a big district, a big state.
We say Republican Party, we say Big Ten, small door.
Yeah,
small doors, good one. What do you got, Brendan Gill?
Then it's not good for me either way. Then.
What do you got?
So very quickly, it's not a. We are in an environment that I would say the word is progressive, not just socialist, but progressive. The politics right now within the party are definitely center-left, but that's because those are mainstream politics, meaning that what you saw going on in New York, what you saw going on in other congressional districts are people who ran on platforms that are about mainstream ideas.
The Bernie Sanders stuff?
Meaning health care for all, meaning a livable wage. I would even argue that although there's indicators that unemployment is down, wages are stagnant. The idea that this economy is doing really, really well, it's one of the reasons that you're not able to run on it because it's really not true out there for a lot of people. So this idea right now within the party that there's a tug of war between maybe left and center politics, clearly what we're seeing is that the base of our party, which I would say is the mainstream in our party, wants to talk about those issues. Those issues are important, and they are mainstream, and they are mainstream issues. Whether you're talking about healthcare, whether you're talking about the environment, whether you're talking about education, these are not radical ideas.
You won't see this manifest itself for a while because Republican, we lived through this in 2010. It was probably more extreme than what's happening in the Democrat Party, but you saw more moderate Republicans losing to more far-right conservative Republicans and then doing poorly in general elections. So in the long term, the definition of the party, what you're seeing now are liberal Democrats, not like conservative, liberal Democrats in New York, in Massachusetts, losing congressional primaries. So the face of the Democrat Party, the ideology of the Democrat Party is going to be very different in 2 years. And so we'll see. There's going to be a fight, just like there's been a fight on the Republican side. But there's a constant evolution in both parties.
I would agree with that.
I've got a minute left.
I agree with that. I'm not sure that what you're seeing right now within the Democratic Party is going to be as severe as what we saw in 2010 in the Republican Party based on the numbers of people who will be elected this November. I don't think you're going to see what you saw with the Tea Party in 2010 happen in the Democratic Party in 2018.
Guys, 2 seconds left. Look at this civil, respectful, collegial discussion between a Republican, Mike DuHaime, and a Democrat, Brendan Gill. Why is this not taking place across the country, and why is there so much polarization? divisiveness and, hey, we can't talk.
The media,
30 seconds,
the
go.
media has changed tremendously now. You can self-select what you do.
No, it's us, Mike.
It's your fault. No, it's fault. No, it's allowed people. It's allowed people to self-select. So if you're a Republican, you can get your news from Breitbart. You can listen to Hannity and Rush in the car, and then watch Fox News when you get home. Same with a Democrat. You can watch MSNBC. You have to have actual discourse with real live human
Brendan,
beings.
what do you got? A few seconds.
I agree, and I would say finally that it's okay to be passionate. We have to accept that it's okay to be passionate about issues.
Not nasty and name-calling, and we can't talk.
But right, but that we can agree to disagree and work towards common purpose. That's why I'm involved. I still believe that, and we can still get there.
Brendan Gill, Mike DuHaime, I'm Steve Adubato. Just
Thanks,
listening
Steve.
to these guys. Check you out on the State of Affairs next time. Thank you, gentlemen. See you next time.
Thank you.
That was good.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris and JTV studio at 2 Gateway. Funding has been provided by the New Jersey Education Association, the Turrell Fund, supporting Right from the Start NJ, the Northward Center, New Jersey Sharing Network, Summit Medical Group, Delta Dental of New Jersey, and by Keystone Mountain Lakes Regional Council of Carpenters. Your future is in our building.
Hi, I'm Dennis Wilson, President and CEO of Delta Dental of New Jersey. You probably know that visiting your dentist and daily at-home care are necessary for maintaining good oral health. What you might not know is that your oral health is connected to your overall health. Oral health may impact conditions like diabetes, blood disorders, and heart disease. Regular cleanings and checkups allow your dentist to assess your risk and keep you and your smile healthy.